And I think that's an important message that we need to continue to push out, because people with pneumonia, people with severe pneumonia, people with acute respiratory distress syndrome, people with septic shock, people who need oxygen and respiratory support, we have guidance that's out to work with clinicians where we've learned from frontline clinicians who are dealing with COVID-19 patients and how they're dealing with patients now before we have that treatment. We want the treatment, we want a safe and effective treatment, and these clinical trials are underway. But until we have that, there is some supportive care that is out there and that clinicians can use. In addition to that, we are working with ensuring that healthcare facilities and health facilities have the right equipment to be able to care for patients depending on the severity of their system, to build treatment centers in areas that don't have treatment centers. And so there's a large amount of work with huge teams that are trying to build treatment centers in countries that don't have those, so that they can be used for COVID-19 patients and any patients that need care. We're working to supply oxygen to ensure that oxygen can be available to people who need it across different countries. So I just wanted to add that to say that while we are working hard to accelerate the knowledge around safe and effective treatments, there are supportive treatments that are out there, and we're working with clinicians worldwide, listening to them, learning from them, putting out guidance, doing training, so that there is care that's out there in the meantime.
Many thanks, Dr. Swaminathan and Dr. Van Kerkhove. It seems we are back on our social media platforms, so those who were watching us on those channels may have opportunity to see those few minutes that were missing on our footage that will be available afterward. I understand that on Zoom, where we have our journalists, everything was functioning normally. We have a time for one or two more questions, so let's go to Jamil Chade, Geneva-based correspondent for Brazilian media. Jamil? Hello, Jamil. Yes.
Yes. Thank you, Tarek. Thank you to all of you. Mr. Ryan, last week we spoke about, you spoke about Brazil and how the situation was still very intense. A week later, we have an even more difficult situation in Brazil. Is the war still to come? How do you see the progression of the case in Brazil? Thank you.
It's difficult to predict, but if we look at this as we look at the different the hemispheres, I mean, 5 of the 10 countries worldwide reporting the highest new number of cases in the past 24 hours are in the Americas: Brazil, USA, Peru, Chile, and Mexico. And that covers a vast stretch. The countries, though, reporting the biggest increases are Brazil, Colombia, Chile, Peru, Mexico, Haiti, Argentina, Bolivia. And we're seeing, while the numbers are not exponential in some countries, we are seeing a progressive increase in cases on a daily basis. It's across a range of different countries, and countries are having to work very, very hard to both understand the scale of infection, but also health systems are beginning to come under pressure across the region. We're particularly concerned about places like Haiti because of the inherent weakness in the system. There are other countries in the Americas in which health systems are also weak. There are different responses by different countries in the region. We see very good examples of countries who have an all-of-government, all-of-society, inclusive, scientific-driven approach, and I think we're seeing in other situations an absence and weakness in that. I think we now absolutely need to focus on supporting particularly Central and South America in their response. The DG has said many times, no one is safe until everyone is safe. And many, many weeks ago, the world was extremely concerned about what was going to happen in potentially South Asia or in Africa. And to a certain extent, the situation in those two settings is still difficult, but it's stable. Clearly, the situation in many South American countries is far from stable. There's been a rapid increase in cases, and those systems are coming under increasing pressure. And they need our support, they need our solidarity, and the complexities of the population structure, the number of people living in urban settings, the urban poor. There are so many factors that drive and increase the intensity of transmission. But I would certainly characterise that Central and South America in particular have very much become the intense zones of transmission for this virus as we speak. And I don't believe that we have reached the peak in that transmission. And at this point, I cannot predict when we will. But what we do need to do is to show solidarity to the countries of Central and South America. We need to stand with them. We need to provide the support that we can to help them overcome this virus, as we have done collectively for countries in other regions. This is the time to stand together and leave no one behind.
Thank you, Dr. Ryan. So maybe the last question for today's press conference. We will go to India TV, and we have with us Siddhant Mamtani. Can we hear us?
Can you hear me?
Yes, we can hear you.
Thank you for taking my question. So my question basically follows up on what Sophie had to say. The general consensus in India is that the lockdown was imposed in the country at a very early stage when the cases were fairly low. The fourth phase of lockdown came to an end yesterday, and a partial unlocking of services began today. So at the same time, the number of cases in the country are touching 200,000 now. So do you think there's a relation between these partial opening of services and the rising number of cases? And if so, then how do we balance the resumption of economic activities and at the same time control the coronavirus lockdown? Thank you.
I think you've sort of answered your own question there quite well, in the sense that it's exactly that question. How do you balance the needs of the economy and society against the needs to control this disease? And that certainly cannot be done from a place like Geneva. That can only be done by national governments who are working locally to understand the local situation, understand the local context, and absorb the global guidance and the global scientific consensus that's building. And we've had many, many countries over the last number of weeks and months at our weekly briefings with all our member states and missions. And it's been striking to me the success that countries have had, and I've been trying, to be honest, to understand what's been the magical formula for success in this response. And to me, what I'm seeing beyond the epidemiology and beyond the virus is that countries that have taken real ownership of the problem politically and pulled in the maximum amount of information from outside, and then adapted and driven a local response with communities on board, have done well. This has not been about global knowledge just stopping the virus. There's an essential second step, and that has been responsible, open governments looking and seeking for that scientific information within the country and from outside, and translating that into actions and into programs that communities understand and accept and support. And where governments have taken that all of society, all of government approach, where they've been open to the global and local science, where they've been sensitive and empathic to local population needs, they have found that balance. But that balance and that point of balance cannot be set externally. That is primarily the responsibility of national government. That is what government is there for. So in that sense, WHO will continue to drive the gathering of global science, global knowledge, global epidemiology, continue to do our best to synthesize that into the best guidance we can, to work through our country offices with each government to try and find that balance. But ultimately that balance comes from a responsible government listening to science, listening to the population, and balancing these very difficult questions in a way that people can look at and see that a transparent job is being done to protect them, the economy, their society. Not easy to achieve, but I think governments who have done that seem to have had a success, and we wish India every success in that. India is one of the largest countries in the world, a centre of science, a centre of public health, as I've said many times in the past. It did implement measures early and has a huge capacity to continue doing the surveillance and the community engagement that it has so much demonstrated in the past. But also, India has one of the densest populations in the world, has pockets of real poverty and underprivilege, and we really do have to ensure that those populations are protected and that India remains vigilant, ever vigilant, moving forward as it takes slow steps towards fully opening its society. I don't know, Sumi, you may have a comment on this, given that India is your home country.
No, I think you put it well, Mike. I think there are big challenges, and one of the unique challenges, I think, is the density of population, particularly in the urban areas. And what I've seen of the data from India is 70% of cases and deaths are in 13 cities, the most populated cities. So that's where really there's a need to focus attention. And even within those cities, there are areas, there are micro-clusters of disease. And of course, those people are also probably in the weakest, most vulnerable living conditions as well. And so I think this is a challenge, but needs a strategy to address those specific challenges that exist. And I think it's a combination of what you were saying, Mike. It's a combination of involving the local community, developing a plan that is bottom-up, that is participatory. It should be based on real data. A lot of testing and contact tracing needs to be done. And there needs to be constant monitoring and a constant, perhaps, reorientation of the plans based as the data emerges. There's also the issue of protecting the frontline workers, whether they're policemen or whether they're drivers, bus drivers, ambulance drivers, nurses, and doctors. I think we must not forget that these people are at very high risk when they go into these densely populated and high incidence settings. But there are good models that within India that have shown that it is possible to do, and so I think we have to remain optimistic.
If I could just briefly add, so going beyond India, I think the responses so far specific to the context of India are critical, but I just want to take it a little bit beyond that to say that there are a lot of countries right now that are lifting lockdowns, so-called lockdowns, and a lot of them are doing it in a slow way. And as Mike and as Sumya has said, it needs to be done, it's very context specific. And so not everything can be lifted all at once. This virus isn't homogeneous. It doesn't spread evenly. It likes to exploit the vulnerabilities. It likes to exploit close contact. And so it's important to have these lifting of these measures done in a data-driven way and to have the systems in place to have that. But the one point I wanted to make is that in a number of countries that we're seeing the slow lifting, we are starting to see in some countries some increase in case numbers. And that delay is about a 2 to 3 week delay from the time that the lifting of the lockdown starts. And that's important because we know the incubation period, which is the time from when someone is exposed to the time they develop symptoms, is on average 5-6 days, which means that between 5-6 days and then another 5-6 days, you may see more and more cases. And so to have the data, the system in place, the public health infrastructure in place to capture that data means you need to track these individuals over time. So while some countries are starting to see an increase again with the lifting of those lockdowns, that is not necessarily a negative thing. We don't want to see any more cases. We want to see transmission suppressed, but it is important that countries are monitoring this, report those increasing in cases, and more importantly, take the measures to stamp it out, take the measures to suppress transmission again, because we all must remain on high alert for this and ready to detect cases and apply all of these measures that we know can suppress transmission.
Thanks, everyone, for these answers. We will conclude this press briefing here. You will have the audio file available shortly, and transcript will be posted tomorrow. We thank our interpreters once again for being with us today, as well as all speakers and all journalists who were with us online, as well as those who were watching us on social media platform. There were a few minutes that we lost the signal. The full video will be available on our YouTube channels and on our social media platforms as well. We will continue sending you news from headquarters, from our regional and from our country offices about what WHO is doing. I wish everyone a very nice evening.
Thank you also to you, Tariq, and to all who have joined us today. Thank you. Have a good evening.